I work for AUT, senior lecturer and researcher at AUT. So this is normally a good place to start with most people because understanding what's important to you is what's important to me at the end of the day. Just some general goals here. If we take a little look, take control of my future, build my confidence, improve well-being, quality time with family and friends, reduce the chance of another event. Often get questions around understanding and the anxiety side in a little bit more depth as well. So we look at broad goals and themes and values, and then we try to look at where the exercise can connect into that, as part of a holistic or broad view, because obviously there's all sorts of components that come together. It's as broad as you like. I'll then also kind of mention what tends to get in the way, but maybe a little bit more of the positive side of it, that is the strategies that you might use to address some of these things, right? So I've just popped up here just some common barriers that people tend to throw around. This is not everything, this is just a few ideas again. And really just want you to have a little bit of a think about some of these things, and you might have done this in previous talks that you've had here, etc. In terms of identifying what sort of strategies that you could have or use to help address some of these. So, I mean, I've got lots of ideas on these, but it'd be interesting to hear whether anyone sort of had something that's been a little bit tough in the way, and then what you might have done to overcome that, or at least mitigate something to a degree that you can move forward. So just some food for thought with values, goals, and then strategies for barriers. Not saying we have all the answers just a second, but it is certainly something that we tend to think about. And of course, different people and different health professionals with different services obviously have input and elements of that. So I'm going to hone in more on the exercise side now. And when I talk about the word exercise, I mean physical activity as well. Physical activity technically is an umbrella term for anything that you move and do something. However, we tend to talk about or use the word exercise generally as a little bit more structured or has some intent of doing or something, as opposed to a bit more incidental, what we do kind of day to day that happens to occur, all right, in terms of movement. Now, people use those terms interchangeably, and I won't define them specifically, but so I'll talk a little bit about physical activity as more the two work hand in hand versus something structured, and it'll all make sense when I talk about what it takes to elicit some change, I guess, so to speak. So I talked about this last time, so those that were here before have got a little bit of a heads up on this already, but I've just taken a different approach to this. We have all these kind of risk factors, that get mentioned and, form a part of a focus, rightly or wrongly, because there are many things to think about, and, that are different to exercise. So exercise sits in there as one of these. Obviously nutrition, sleep, and other forms of stresses, but you tend to get these types of things like what's your blood glucose level or HbA1c, whether people smoke or not, alcohol intake, body composition measures of all sorts, cholesterol measures of which there's a variety, and depending on how things are measured as to how good they are, blood pressure and a few other things thrown in there as well. So when you take some of these measures and just take a second to scan across these, if you're having trouble seeing them, we've got body mass index, cholesterol, smoking, high blood pressure, cardiorespiratory fitness, And then the diabetes is more coming from the blood glucose, or HbA1c, which is a chronic measure of glucose attached to your red blood cells. But that's kind of the basic ones. Where do you think they rank? Because where they rank is not necessarily how the perception that the public necessarily gets is my point. So what do you think gets the most attention in this sort of list? I mean, they all do, but what do you think gets more or less?
Body mass is the most obvious to
Yeah.
everybody.
Yep, and you can kind of think of it as well, like what might a doctor talk to you about, you know? Yeah, so top one, yep.
Diabetes.
Yep.
Smoking.
Yep. Good, okay, all right, so let's have a look at them in terms of the evidence, of which a number of studies have been repeated and found much the same thing in terms of, I'll explain what this means. So in the colours that we've got here, we've got females in the orangey colour, we've got males in the blue. We've got a large trial with 40,000 men and close to 13,000 females. It was done a little while ago. Modern trials have a better balance between males and females. And then on this side here, we've got attributable fractions, or percentages, if you think of it in an easier way, the likelihood, of risk reduction from these different things. So we've got them along the bottom here, and so straight away you can look at the ones that are larger, taller bars, have stronger effects on outcomes for people. Now the outcome in this is a bit of a morbid outcome. It's all-cause death. But you could look at all sorts of outcomes, health outcomes, quality of life and other things as well, right? And similar trends with some slight differences occur. So some of those things that get a lot of focus, like body mass index, which falls here, cholesterol, blood sugar, everything's important. So the message here is not to belittle anything. Everything's important, but how much attention does it receive overall? So what's going to give you better bang for your buck is kind of a little bit of a key idea of sort of where I'm coming from. Strategies where, for example, I won't present today, but where you have studies that control for things. That is, if we looked at this cardiorespiratory fitness, that's the highest on the chart, with blood pressure being next, especially for males, and then said, okay, well, what if we controlled for all other factors in a study, as many as possible, and sort of said, okay, are those other factors related to it and contributing to things, right? And so here, when you take body mass index as an example, regardless of what that is, now I'm not talking about joints and stuff like that because that's a little bit different, but from a health outcome general perspective, when a person is fitter, regardless of their body mass index, they do better, all right? And then people that are very low on the body mass index score and are unfit do not do well, right? So a lot of this gets wiped out, I guess, in terms of predictive ability when you control for it in these types of studies. So it's not adding a ton of value at the end of the day, but it does have some important implications, other health implications. And so that's where this next slide here just gives you a little bit of a feeling for where things feed or are related to one another, right? So I've just taken an image that comes from one of the overseas countries, one of their infographics that they use from one of their heart organizations. And it says there, 10 steps to protect your heart. And it might be a little hard to see from the back, but it has a whole lot of the typical suggestions, and these are often risk factors or things that you can do to help yourself, right? So it has the nutrition, it's got the moving more, It's got get checkups, it's got blood sugar, it's got blood pressure, it's got cholesterol, sleep, alcohol, body weights, and smoking, yeah, are the key things up there. And then again, if you look at what exercise is related to or what it supports, it's a good chunk of those, right? Obviously, some things are their own thing, yeah? But for these things, it's okay. If you think of what's going to improve blood sugar, blood pressure, and I'll highlight blood pressure coming up as an example. Cholesterol to a point, but cholesterol is very dependent upon what you do and how you do it. Okay, because you can follow physical activity guidelines, for example, and get little to no change in cholesterol. Or you can do something more individualized and bespoke and get significant changes in it. And it's the same with other factors on there. And some things are a real challenge because some things initially exercise has less impact on. So for example, what most people who have had a cardiac event and all the barriers and considerations that we've talked about before and other things limits kind of what people can do with respect to something that a GP might say, they might say, you need to lose weight or something like that, right? It's a common thing. And that's very, very hard if your only strategy was exercise and not the nutrition. However, it's not to say that this doesn't help. It does, but it requires a lot more of it to get to that point. And to get to a lot more of it requires steps, like we talked about. Yeah. Now, that's not everyone's goal to do a ton of something, and you don't necessarily have to, but understanding where it fits in and also not to be set up for failure, I guess, is more the point with that. So what kind of level of contribution does it have? Yeah, so if anyone, when people say, I've sat there before in a talk for cardiac patients, I remember about 8 years ago, and then the speaker saying at the time, and of course I'm not going to name them, saying that exercise is no good for weight, period, with no context to it, which me sitting there, I'm kind of like, well, if that was true, then all our endurance athletes, why do they look the way they are? Yeah, because they do a heck of a lot of it. It's horses for courses, right? It's context, yeah, with it. So yeah, it's not quite true, and you're missing the point of all the other benefits. Okay, so the question from exercise and physical activity, who would benefit from it? And that's one of the things that our services, our public health services, tend to narrow down, and obviously this is partly to do with resourcing and so on and so forth in the systems, but usually coronary artery disease is kind of the larger group, or as it would be termed, acute coronary syndromes in the hospital would be more the term they would use, yeah? But you've got all these other and many other very specific things that, these might not identify with you, yeah, is what I'm saying. But overall, everyone would in some shape or form. Now, to what degree it will improve specific elements in here. So if I took, for example, heart failure is a very, very large group that falls under the cardiac umbrella, and that heart failure can be categorized into different severities, yeah, depending on what's going on, and the different types of heart failure. And so within that, if you looked at what effect exercise and physical activity has, it can be more in some groups and less in others, yeah? But is it worth it is the question overall, and it definitely is, right? Because there are things far beyond just focusing on the heart, okay, that are beneficial. So let's dive in a little bit further. Okay, what's the value of exercise-based cardiac rehab? Like right narrow, straight into what typically gets done, yeah? And this is not looking at the best form of it. This is just general cardiac rehab from hospital programs, typically, in these types of trials. Again, it might be a little hard for you to see, so I'll just give you a few of those kind of figures off the screen. So the top one just talks about the lower mortality rate with participating in cardiac rehab of being 32 to 40%. And we get this range. It actually sits anywhere between, depending on the quality, from no benefit in poorly done stuff, like some reviews of what happened in the UK, UK's programs, which underdo it, don't provide enough of it, right through to 60% reduction in the best of the best, So that's the true range, but from this review, that was their numbers and figures. We certainly know that if you attended more of it, you get more benefit. But again, that doesn't talk to the quality of what's being delivered. Right? So it's a lot to do with, like we talked about earlier, habits. That having that frequency of doing things, normalizing it in there, has a larger impact for sure. And then the quality of what you're doing. Some insightful views of, I guess, if you compare two things, like coronary artery stenting is a good example. And again, the technology in those fields keeps advancing, but so some of the studies come from times where the technology was slightly different. So that's just bear that in mind. But a lot of people don't know the effect of being fitter and being active and its chance of reducing the risk of those stents, blocking up again, right, is halved, which is a big number, right? If you're 50% reduction in that, and that's even in a short time frame. So that's quite neat. Most recent stuff actually shows people that do really good exercise versus those who don't have who aren't stented versus those that are stented have the same or slightly better benefit from the exercise. Now, I'm not saying don't get stented because and I'll get told off if I said that.
Sorry about that.
That's okay. But because particular people obviously have a greater need for something as opposed to when we talk about averages of something. So just to be clear, when we talk about study averages, they don't relate always to an individual's requirements. And it's the same deal with blood pressure. To a point though, severe hypertension is a little bit different. The drug effects are more substantial in very severe hypertension or high blood pressure. But for mild to moderate elevation of blood pressure, exercise effect is the same as the medications, actually slightly better in most of the studies. But the key thing here is if you combine the two, it doesn't double it, all right? You don't get an pure additive effect, but it certainly increases, all right, if you pull the two together. So again, it's just putting it on stage with what people typically, think of as normal gold standard treatment at the end of the day. Okay. Other benefits, and people always ask, or maybe don't necessarily think about the broad context of benefits, and I haven't gone to town on all the broad benefits, especially psychosocial and other factors here, all right? So I've just taken some pretty standard kind of stuff that usually gets focused on a lot of the research, but obviously there's a lot more to add. And if we went, okay, when I see these types of lists with benefits, the thing that frustrates me or what I want to know is how much. Okay, how much of a benefit? It's all very nice to say something improves, but the question that I have is it worthwhile? Like, is it a negligible improvement Is it, a bit bigger than that? Is it small? Is it moderate? Is it large? Or very large? Yeah. So a lot of these things here fall into the category of, except for a couple, like cholesterol is very dependent on how things are done. But a lot of the other things fall into the categories of anywhere between the upper range of small to large, okay, generally speaking. And some things that people don't tend to think about too much, like immunity or immune system function. So that's something that I'm highly interested in from a research perspective at the moment in a different population, in the cancer populations. But immune function in everyone generally tends, unless there's something very specific going on with some, interacting with the immune system function, which certainly could be, right? Because you could have anything from a deficiency in something to some genetic trait, all sorts of things that could affect immune function. The list goes on. But generally speaking, the fitter people are, the stronger their immune function. And so when you look at studies that have looked at things like, simple infections of everything from the flu, colds, you could look at the studies that played around the time of COVID, for example. The outcomes there for fitter people were much greater or better than for less. So people presenting in hospital with complications and so on and so forth, etc., tended to be much higher in those populations. The same goes when people end up in hospital situations where they require surgery, yeah? And of course, how fit you are is a criteria for anaesthetists with respect to whether they'll go ahead with surgery or not, right? Because if we're going to suppress your body's systems under a surgical procedure, the risk can be too high if the fitness is too low, right? So they might say, unfortunately, no, we can't until we get that up, yeah? But common things like pneumonia and other types of infections that can occur are certainly much, much better if people are fitter. All right, so there's a whole host of possible things running through there. A little bit more pointed and back to the idea of the individualization and tailoring of things. And then that's where I'll just sort of finish off today. So here I've got a bit of a table, if you can see it, that looks at generic, and it's quite hard to define because there's very sliding scales of what people deem to be physical activity / exercise in reality. But I've tried to go on the average of the example of health promotion physical activity. All right, that's kind of where I pitched this as my example down here of like guidelines for what people could do. Now, in those guidelines, if you took the absolute best of those guidelines, you could do well, all right? But that's not where most people sit, unfortunately, and wouldn't necessarily even be able to start at that point, all right? They'd need to begin at a lower point and build up to something, yeah? So if you look at just telling people to be obviously active, yeah, the likelihood that just telling people or somebody reads it on a website or social media or something generally is on the low side of things, yeah, in terms of behavior change. If you individualize things for people, yep, you're far more likely to get better uptake for the longer term. The likely benefit, as I say, if you took the best of it and you were highly motivated and you did everything perfectly, you could get some good benefit, but that's not what we actually see in reality from research studies. And then again, individualize narrows and prevents the likelihood of people not responding to exercise. So we get far greater benefit from individualizing things. And hopefully that just makes sense, because like in anything in life, if it's tailored to you, then you tend to get better outcomes. Accessibility, very mixed, depends on the place, how things are offered, could be anywhere and everywhere with that. It's quite hard to make judgment on that side of it, hence it's low to high and individualized, but generally high if you could do something from home without too much help. Cost, could be anything from low to moderate with generic, through to moderate to high with individualized if you're getting very personalized help. And in suitability, well, the physical activity guidelines actually were made for prevention, not for treatment, but we've kind of taken them and then just thrown them into the treatment category and gone, well, this is not going to cost us much, so hopefully this will work, and we see some benefits, but I guess the point is, could you do better? And the question is, how much better? And it's a lot better. Yeah. All right. So a couple of the other things. I think down here, where exercise intensity and volume is pretty self-explanatory. That if you're manipulating things and it's individualized, it's specific to you. If you're being told, if I've been told to walk at 4 kilometers per hour, okay, which is this kind of speed, like 4 kilometers per hour, and you're walking at 4 kilometers per hour, which is a physical activity approach to energy expenditure prescribing exercise. They're two different things. They're two different stimuluses for you and for me. All right, they're not the same. All right, and likewise for others here. It might be enough stimulus for some benefit for some, and it might be definitely not for others. I know if I walked at 4 kilometers per hour and I did that for 30 minutes, 5 days per week, as per physical activity guidelines, and I took anything else away that I do, my fitness will decrease over time. That's what will happen, yeah? Because the stimulus is not enough. All right, so if you use the exact same absolute thing, it's incomparable between people, all right, is my point, yeah. Okay, so, yep, there's some distinct advantages to individualizing, of course, like we talked about. Usually we refer to the idea that we assess or help somebody establish what's going to suit them, yeah? That's a nice starting point. No different to talking about goals and values and various things. We would work through what's going to work for somebody and then look at, obviously, how to implement that and give that guidance. And here we're trying to develop a level of independence, a skill set that you can apply for the rest of your life, right? That's the general concept. And this, I think this graph, I included it in here from last time, but just tweaked it a little bit. This one helps explain, hopefully, the idea, because here before I was talking about speed of walking, and here's 4 kilometers per hour, yeah, on the bottom. This is kind of typically what we get with a graph, although I've put pictures on it and labeled it and stuff. When we assess a person's fitness or components of fitness, look at safety monitoring, okay, for a person, what's appropriate, what's not, yeah, those sorts of considerations. And usually when we assess a person, and it's not to say, like, lots of people would individualize how this goes, but people hit a certain point where you would describe what you feel is probably more challenge breathing, unless some other symptom sets in earlier, like abnormal shortness of breath, could be, dizziness, chest pain, those sorts of things. Yeah, that might be limiting you, or there could be some pain in your knee or hip or something else, right? And those things get taken into account. But if you didn't have that limitation and you could get to a point where you got slightly challenged breathing, you're typically hitting what we'd call a physiological threshold point. Now, technically, there are 2 of these points, but I'm not going to get into that today. All right, that's for a little bit more advanced prescribing of exercise. But generally speaking, the concept is if we spend all our time doing activity, below that point, we have to do a lot to elicit some change. All right, that would be like an endurance athlete just doing long, slow distance, say they're a runner, running, and they don't do anything in the higher intensity range. They have to do lots and lots of it to elicit a change, right? If you take a team sport and then you look at, okay, how much volume of training do they do? It's typically smaller, yeah, than an endurance athlete, but it's of a higher intensity, yeah? So you've kind of got this balancing point of continuous exercise that's of a moderate intensity here versus something that changes with the intensity to generate enough stress to cause adaptation, right? And if we don't create the right kind of stress to adapt, then we're missing out on a lot of the benefit, is the point, right? So if all we do is very gentle things, yes, we get energy expenditure, but we don't stress the body enough for all the benefits we've talked about on those previous slides. They come from pushing a little bit of this threshold point, okay, typically, or doing a large volume. But most people don't want to do a large volume, I can tell you that now. 30 years of prescribing exercise for people, yep, that's not everybody's cup of tea, right? So that's where this sort of idea of being below it and above it with how it feels to you kind of kicks in. And that's how we customize it. And the only way, well, not the only way, but there's a few ways to assess that. All right? You could do subjective measures of people in terms of how they feel, but we typically physiologically measure these points when we assess people. And then we quite precisely then go, okay, this is where we'll start, but this is where we're aiming to get to down the track. Are there any safety considerations we need to consider? And then therefore, what do we do about that? Yeah, all right. And when you do that, when we talk about fear and anxiety around confidence, okay, to do things, it helps a lot with it because then you actually know how you respond and why we're giving something specific to you for that outcome. Yeah. So we're not going to then go, oh, okay, you told me you had angina down here, all right, or some chest pain down here. I'm just going to ignore that and I give you that high intensity in the hope that you'll get some benefit. But obviously, does the risk outweigh the benefit? Yeah. And of course, we wouldn't push that envelope, right? We'd choose something that is appropriate. And that comes within, reports to cardiologists and other health professionals, so that their input comes into that as well, right? It's not a standalone thing with respect to safety, because there's always things and factors that we need to consider. All right, so what would be, this is a nice one because people often sort of think about what is it that I need to achieve, or what would be nice, okay, to be independent, or what we'd think of as having a really good skill set. And again, you could talk about all the physical things, all the psychological things, social and other aspects, right? A broad variety of things. But some of the key things, which I've labeled here, are that there's no major reasons that you can't do the things that have been prescribed, right? Hopefully, that would be good. If there are, then things need to be looked at again. That you've received enough education specific to you, you've developed some level of perceived value, because if you don't have that perceived value, then you probably don't want to do it, yeah? And that's not going to drive intrinsic motivation and a level of confidence to keep it up, right? To form a habit, to normalize it. So that all pulls into this idea of, so if you were to go and do things, do you have an applied skill set that you could, I'm not saying you have to do stuff by yourself, but if you needed to independently make a decision and do something and monitor yourself, could you do it, is the question. That's what we're kind of looking for, that you've got that level of skill set. However, in reality, it generally is more fun doing stuff with other people, right? Because of obviously the social side of it. But even in a group of people, you can do things, you know what you're doing to suit yourself, yeah? So I talked about monitoring signs and symptoms. You know what to look for. You know what decisions to make if things aren't quite so right on any given day. That's usually what we teach. Yeah. The ability to modify things as you adapt. So if you start somewhere, get a little bit fitter, what do I then need to then keep stepping it up, right? And then what does maintenance look like? What's good enough for you, for your goals, and then how do you keep it there? Yeah, becomes a thing too. What happens if you get sick or ill or something changes? Then what do you do? Yeah, those types of things that come along. And often people, have something like a head cold and that goes around for the year and 2 to 3 weeks off or something like that, if it was having a major impact, and then slide off and then think that they've lost all their benefits, which is actually not true. Depends what you're measuring at the end of the day. You don't lose everything, okay, in just a couple of weeks. It's not quite how it works, yeah? Yes, it will feel just slightly harder to get back into something, but very quickly things will pick back up to where they were. Can you do things in different environments? All right, different environments. You could see so that you could choose any environment you want to do something in, whether it be at home, some community facility, I don't know, out in the bush, okay, when you go on holiday, whatever. Are you adaptable? All right, got some resilience there. And then lastly, have you got some wraparound support? Because there will always be things that come up. So lastly, just some of those key messages. So at the top there, I talked about that cardiorespiratory fitness is a very important risk factor and strong modifiable predictor of health outcomes. Super, super important. Everything's important, but it needs probably a little more attention across the board. Secondly, an increase in physical activity, all right, depending on how that's defined, does not necessarily translate into improvement in your fitness. Okay, you can do things that expend energy, and that's good, not to belittle it, but it doesn't necessarily mean you get all the big benefits that get quoted to you or reasons for doing things. So it might not result in the health outcomes that you're hoping for, all right? So understanding what's quite right is an important thing. So ultimately, we'll individualize things for more meaningful outcomes for people. And when we say how much in there, so some studies that have compared very basic physical activity guidelines versus let's push things a lot further, can be twice the benefit and sometimes higher than that. So it is quite profound. And then you've got some skills with this idea of working towards independence and then hopefully taking control of things or feel like you have enough confidence that you've, as I said before, hopefully got to that point of some level of acceptance, develop that intrinsic motivation, have all the support that you need, etc., which can be tricky at times. But hence my cheesy little thing on the bottom there, step out of the passenger seat and pilot your health. Yeah, it's about feeling like you can take back some level of control, right? And to do that, people generally need some help and assistance with it. Yeah, okay. So yeah, that's where I will finish things up. And yeah, I'll open it to you guys if you have any particular questions.